welcome to Not for the Faint-Hearted. This is episode 3 or 4 or something. And really well organised.
Just make it 10. That's
fine. My name's John Hung. I'm an interventional cardiologist from Liverpool. And I'm thrilled to be joined by my friend and colleague, Dr. Scott Murray today.
Hello.
You all right, Scott?
Yeah, I'm fine, yeah. Still here, still alive.
Good. Despite your anomalous coronary artery.
Yep, it's still there.
Still not caused you any
It's been there.
Big problems.
I'm getting dizzy when I run. That's the one thing I've noticed. When I get my heart rate goes above 175, I feel like I'm on a globe. I'm like, there's rotation. I've got no chest pains.
Have you removed the leather and the neck straps and the gimp mask and stuff?
Yeah, no, that's maybe the Viagra's doing it. I don't know.
Yeah, got to be careful with that kind of stuff.
Careful, yeah.
All right, well, welcome to the episode, guys. And today we're going to talk about what should you do to monitor your health? How can you not necessarily take control, but how do you know if things are going well or things are not going well? If you're in your 20s, you probably don't care. If you're in your 30s and nothing's happened, you may or may not. By the time you get to my age, and definitely your age, then you start thinking about this stuff more and more.
Mommy, gonna die.
I don't want to die, Jerry.
Don't worry, son. We'll take the side off your house.
They have to take the front off the house.
We got a pallet truck outside.
I don't want to die, Jerry. If you don't know that reference, it's probably best not explained.
No.
So what you do? So how do you know? So let me frame this. I get loads of people, patients, friends, colleagues, whatever. Should I get checked out? And I think once the thought's entered your mind, probably you should at some point. But what does getting checked out mean? And if you've already done that, or, even if you haven't, how can you monitor your own progress? And there's so much stuff, We can talk about the medical things, but then there's also the kind of this massive market now in wearables.
Yeah.
Like this kind of thing.
Yep.
And this kind of thing. We're all doing it. And sometimes it's good. Sometimes it's not. So we'll get into that. What should you do? How do you monitor your health? And what are the pros and cons of these things? I mean, what's that on your wrist?
It's a Whoop band. Yeah, I find it's been useful for me because I like to know, well, I kind of know when I wake up how badly I've slept. I'm like, but then you look at it and you're like, right. And then it's kind of made me focus on my sleep a bit more, and particularly trying not to eat 3 hours before sleep, at least 3 hours, because apparently if you eat, it disrupts melatonin. I've actually started being more like putting the lights down in the house at night when it goes dark outside, so I'm not like staring into a light bulb, like blue light filters on the phones and the laptops and stuff like that.
So you're really focusing on your sleep? Yeah,
because I think it's critical for heart health.
It's so important, isn't it?
And for, we talked in the last one about fat loss. You ain't going to lose fat, and your fat cells ain't going to work if you're not slept.
So what are your tips to get a good sleep?
Stop eating at least 3 or 4 hours before bed. Don't get exposed to bright lights like this when it's dark outside, because you're basically telling your body when the light hits your skin that it's lunchtime. And especially when it goes in your eyes as well, you're blocking melatonin release.
Alcohol?
So all right to get you off to sleep if you're absolutely banjaxed, but but you're going to wake up because it's a suppressant, isn't it? And then when it gets to it goes back to being when it gets to being a stimulant again, because your body's constantly processing that at 1 unit an hour, isn't it? Your liver's like, fucking go, boys, let's get rid of this toxin. It's the same with
your
sugar.
Your liver talks a lot of fucking shit.
What?
Your liver's all over it, innit?
Oh yeah, no. So it's like boom, 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 and once you get your alcohol, your level gets to in the blood again at a certain level, it becomes a stimulant. So you wake up, and that's when you've had that horrible moment where it's 4 a.m, you're sweating if you look at your heart rate at that point, it'll be like boom, 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 boom. You've got the heart banging.
Right. So let me just stop. Hang on. So don't eat before bed. Avoid bright lights, blue lights. Don't drink before, well, not drinking alcohol is a pretty good idea in general, but don't drink, too much. If you do, it will impair your sleep. What else?
Magnesium has helped my sleep. A dose of magnesium before bed. I don't know what it does. It does something. And it's actually helped my wife as well. We'll need to look into the details of it. I've looked it up, but I've forgotten. It does something.
So it's not just bro science.
Yeah,
the magnesium.
I think it does something with cofactor.
All the anaesthetists listening are like, magnesium's amazing. Treats everything. 2 grams magnesium.
A cold room or a coldish room.
Cold.
Very dark.
Very
you don't
important.
have any lights on. If you sleep with a light on, then you're fucked basically, because the light is hitting your body and telling your body that it's lunchtime. So yeah, a dark, cold room. Earplugs help me massively. Silicone earplugs, because I'm like, the slightest little noise, I'm like, what the fuck? I'm like a twitchy dog. I'm like, whoa, 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 whoa. Like when there's like a little noise outside. Do you know what I mean? So big earplugs, so no noise really helps as well. And getting to bed at the same time and getting up at the same time every day.
It all seems so fundamental. I feel like my mum told me this 30 odd years ago.
When you get up, I know it's a bit weird.
But we need reminding, don't we?
Try and get some sunlight and actually in your eyeballs. I know it's a bit weird, but it does tell your body it's light now, it's daytime, and then you're getting it dark at night, and then you're getting your circadian rhythm back. You find that you actually wake up just before your alarm. It's weird.
Yeah.
And you're like, oh, and you look at and you go, oh.
When you've got that regularity. Have you seen those chili mattresses?
Chili mattresses? Shit, that doesn't sound good. It'll make your balls really spicy. Hot, like chili mattress.
Yeah, chili mattress, yeah.
What is it? Spray you with cold. It's got a chili.
It goes cold.
Right.
Makes you colder. Is what you said about a cold room. I think
cold room but warm under the covers. I couldn't have a cold under the covers. Canal.
Yeah. It's fine.
Really?
Yeah. I haven't got a special mattress.
I like the room to be
I've got
cold.
a white clean one.
But I like it. I like it to be. I like it to be warm under the covers. Do you know what I mean?
Yeah. I think you're allowed a sheet in between.
You have to laminate your sheets so you can just wipe them down.
Yeah. When the nurses come in, they just... Okay, well, good tips. And without going on about sleep too much, so important. So what does your WUP tell you? How does that help you with your sleep?
Because it actually sends you a message.
We should get sponsored, man.
And says
Chili mattress, WUP band.
Says to you like, start to wind down. Don't look at your phone, but start getting into your environment. And sleep happens 2 or 3 hours before sleep. You should have like a sleep hygiene routine. It's difficult because we're all busy, aren't we? And, you got stuff to do. And actually, that might be the only hour or 2 at the end of the night that you've actually got time with your partner or whatever, because you're doing other things, kids, etc. But yeah, I think people should focus more on sleep. And this does help with that. And the whole alcohol thing, it has taught me that if I drink more than 1 or 2 drinks in the evening, that I'm goosed.
So
my HRV plummets.
I was just going to say, what data did you see then?
HRV,
what are the metrics?
heart rate variability, yeah.
So heart rate variability, for those who don't know, is just the time interval between each of your heartbeats. And when you're young and fit, or even just young, you have a high heart rate variability because the heartbeats, according to your nervous system, your nervous system is telling your heart how quickly to beat. And you have a very active nervous system when you're young. So young people have big variability between their heartbeats. But as you get older, that does wane slightly. But it's obviously affected by lots of other stuff, like alcohol, for example. It gives you a bit of a tachycardia, essentially. So the faster your heartbeat is, the less variability between those beats.
Absolutely,
the slower it is, you're going to have higher variability. But we know that a higher HRV, heart rate variability, is a good sign, generally. So alcohol just absolutely trashes that, doesn't it?
It does. You can see it on it. It shows you on the thing. If I had no alcohol and got to bed, sleep hygiene's good. Sleep stress, it's called. It just goes like that, boom, and then it's just on the floor for the whole night. And then when you wake up, it comes back up. And you know, that's what it should be. But if you've had alcohol, it's like,
Yeah.
because you're going through various, I mean, your sympathetic nervous system's on overdrive, you're not resting. You're not rested.
Yeah, you're kind of not conscious, but your body is not repairing.
Yeah. I mean, I got a 1% recovery on my whoop once when I was on a golf trip to Portugal, and I'd just been on the beers all day. I got to bed at a decent time, but I woke up in the morning, 1% recovery. My HRV was like 10.
Single figures, yeah.
And I was like, and it's normally like 90 or whatever.
Do you get 90?
Yeah, I've had it over 100, 108, 110.
It's been years since I've had that.
It might be, I don't know, but
I think I'm
vagal
like
tone.
40s and 50s, like as good as it gets at the
Really?
minute. So yeah, I'm also a bit of a wearables weirdo because I've just got a whoop, and I've had an Oura ring for like since time began.
Is this because of your training? Are you overtraining or something? No.
I think my sleep's not good enough most of the time at the moment.
You're probably on high alert with your own calls and all that.
It's been a busy time in life, to be honest.
Yeah.
So my recovery's been not very good for quite a long time.
It's amazing how accurate it is though. Like
Just looking here.
Yeah.
So 33 I was last night.
Yeah. So if you don't get rid of cortisol at night, then you're chronically stressed. What happens the next day? Any extra energy stored as visceral fat.
Yeah.
Your fat cells don't work. Your nervous system is in high alert. So yeah, that's another reason to sleep, is to squash your cortisol.
And when that happens and you do sleep well, your heart rate variability gradually goes up over the course of the night as your body recovers and those cortisol levels sink, and your heart rate goes down.
Yeah.
So you start off with a normal daytime heart rate of say 60 something, but then by the time you've reached proper deep sleep after a good few hours, if you've been undisturbed and you're in reasonable condition, your heart rate will trough. What's yours?
Yeah, I can get my resting heart rate can get 44, 43, sleep heart rate 30s.
30s?
Yeah, 38.
Mate, you've got heart block.
No, probably not. Probably just my pulmonary artery pressing on the right. I don't know.
AV nodal ischemia.
Yeah, no, like if I wake up in the morning, if I do an ECG on this, because you can do an ECG, if I do a big deep breath in and like vagal stimulus from like holding your breath, get it down to 40, 42.
Yeah, right. That's pretty low. Like, I wanted to say, how many times have you seen a patient referred to you with Apple Watch indicates insert irrelevant thing? Quite often it's I've got bradycardia, my heart rate goes really slow, it's getting down to 44 overnight.
Yeah,
that's fine, mate.
It's fine.
It's fine.
If you're young and you're like, I mean, we as cardiologists, we don't really worry about heart rates that are, unless it's less than 30 or it's more than 180. It's like, and patients get concerned but by what they're seeing on their watch, especially if they get up and about. They're like, oh, when I was walking the other day, my heart rate was 120. Yeah, that's probably right for you. It depends how much you're actually carrying with you. Do you know what I mean? Some people are carrying an 8-year-old child around with them in the body weight that they've got attached to their body, and they come in and say, I'm breathless and I'm tachycardic. I'd be breathless and tachycardic if I was carrying my youngest lad around with me.
Yeah.
I'd probably manage 100 yards and then I have to put you down, mate. But people can't do that when they've got that weight attached to them. Like 40 kilos or 35, I don't know what weight he is now, 35 kilos. What is it? What? I'm just being honest. But I do get referred, like high blood pressure, breathless on exertion. Like,
it's important to say probably that there are pathologies though. So we're talking about the vast majority of cases, and what you see with wearables now is that people have access to data that they would never have seen. So if you weren't wearing a Apple Watch or a Whoop Band or an Oura Ring, you would have no clue what your heart rate is doing, so you'd not notice anything. And that's probably one of the downsides. But obviously, if your heart rate's hitting 30 odd overnight, that can be abnormal, especially the older that you get. People do develop conduction disease within their heart. The wiring system of the heart ages, and of course some people need a pacemaker. So there is a there is an overlap between what is physiological and normal and what is pathophysiological. But for the vast majority of younger people, it's just panicking about nothing, isn't it? And people do get fast heart rates as well. And obviously, if your heart rate's 140 sometimes and you're sitting there doing nothing, that's probably not normal.
Yeah.
But if you're running up a hill or you're on the treadmill, great.
Yeah. I mean, I think a lot of people nowadays since COVID have also got, dysautonomia, which we should probably explain, which is autonomic nervous system dysfunction. So the nervous system that controls temperature, sweating, blood pressure, your heart rate, whether you need a poo, whether your bladder filled up, your bowels, all of that stuff is controlled by a nervous system that you can't control. And there seems to be, since COVID, more people with dysautonomia. That's from my perspective. So increased heart rates on exertion, POTS, which is postural orthostatic.
This is proper foil on the head shit, this, mate.
Yeah. Foil on the head shit. What's that?
Like, you speak conspiracy theory.
No. I think it's definitely, I think when someone's had COVID, some people, I think it's affected their autonomic nervous system. Definitely. I've seen more people with this. Even your average punter who's sensible, a lot of them have become aware of ectopic beats, for instance, after maybe a mild pericarditis caused by COVID. I think they recognise POTS.
I think there are entire clinics dedicated to POTS management in people who are post-COVID. I think that's sort of,
But you shouldn't really be getting worried about your heart rate on one
generally.
of these. Generally, unless it's like 150 plus, because if it's 150, it could be flutter, or it could be an atrial tachy, or it could be another atrial arrhythmia. If it's going up above 180, then that's not right.
Yeah. It's symptoms as well, though, isn't it?
Yeah.
So generally, if you've got heart rate of 110, 120 or something, and you've got no symptoms, it's probably nothing to worry about.
So why do you wear both? Why?
It's because I'm a weirdo. So
what does one do that the other doesn't?
They're both similar.
Right.
I've had the Aura for years, and I like it mainly for the sleep management, like you said.
Right.
Like a lot of this stuff, you learn things up front, and I adapted my sleep hygiene a lot. I know what I should do at the minute. I'm just struggling to do it.
Yeah.
But the reason I got this is because I've just started a new app.
Right.
It's called Hexis.
Right.
And it's a fuel guide.
Oh, right, cool.
So what it does is because I do cycle training.
Yeah.
It links with my cycle training diary, which is called Training Peaks, and it therefore knows all the activities I'm gonna do and have done.
Right.
So, for example, if I've got a big workout tomorrow that's 4 hours, I'm going to need a load of carb for that. Like you said in the last episode, you do need carbohydrates for athletic training, generally speaking. It will then load me a bit the night before. If I tell it I want fat loss, then it will calorie restrict me and a bit carb restrict me as well. So the Hexis is meant to sort of help you to make those decisions. Stuff I inherently know, but it's meant to take the decision making away from you, and it's based on numbers. It's based on how many kilojoules of energy will I or did I burn in that thing, And the reason I got the Whoop is because Hexis also takes recovery data.
Right, okay.
So it also knows if my body's up or down, and that feeds into the decision making about what I should be eating.
That's really good, though.
Aye. I was a bit disappointed because it's not linked with Aura. I still like Aura. They're both really accurate, within a few percent of each other in terms of HRV, heart rate, respiratory rate overnight, temperature. They're really similar, the two technologies. Okay. I don't need to wear both, to be honest with you. I'm just experimenting with Hexis.
And have you done CGM recently, or was that in the past you did the CGM thing?
There's just no point in doing that unless I'm training like really properly.
Right, okay.
Since being a consultant, I've been a bit too busy to be a semi-professional cyclist.
Yeah, I was gonna say, can you just say a bit about, just for people who are watching, are like, oh, you don't need carbs, you can train, you can become fat adapted, it takes months, and you tell your actual story about that, because you did it, didn't you?
Aye.
And then you looked at so for the Noakes fans out there, you did it and you saw an incremental decrease in your performance, even though you were fat adapted, and you'd done it to the nth degree. But as soon as you put carbs back in, you were like a rocket, yeah?
Yeah. You've said it in a nutshell. I've done low carb, high fat, I've done keto, I've done carnivore, done it all. I went properly keto and I was training. So it's sort of proper cycle trainings, 8 to 10, 12, 14 hours a week. And some of the sessions are low intensity and some of them are really high intensity. I found that for the really low intensity stuff, it was okay. Could chug along in zone 1, zone 2 without too much of an issue. But the minute I tried to do anything zone 3, 4, 5, could not do it. Weak as a kitten.
Like me. Remember I showed you my FDP thing? It went up for like a minute and then came right back down again. I was like, fucking nothing in the tank. Just generally deconditioned.
Like you need carbohydrate for high energy, for high intensity work. Yeah, no two ways about it.
It's much more efficient, isn't it?
Yeah, you burn glucose rapidly and you could probably tell me about the ATPs and stuff, but essentially you've got to have glucose in the system. You've got to have it in your blood to burn quickly in order to fuel that high metabolic demand. Big muscle groups use a lot of energy and they need to break it down fast, and that's much quicker with glucose than it is with ketones or with fat. So yeah, there's no two ways about it. But you don't have to, I did carb loading once when I was doing a sportive in Australia, and it was hilarious, man. It must have been about 4,000 calories worth of like nuts and chocolate and all sorts of shit. You don't have to like saturate yourself. If I'm doing a big ride, if I'm doing 4 hours tomorrow morning, which I might, this evening I'll have a relatively carby dinner. I'll have like rice or pasta. And then tomorrow morning, a conservative-ish sort of breakfast, like bit of I love doing it because I can have toast and jam.
Yeah, the things that you had as a kid that you crave.
Yeah. So I'll do that before, and then a bit of supplementation throughout the ride, and then afterwards you still need a bit more carb to help your muscles to recover and replenish those glycogen stores. But then after that, probably I'm gonna keep the carb low after that. I don't need it. So yes, it's about periodization, and that's what the app does.
And have you ever hit the wall?
About 1 million times.
Yeah. And then, so like...
bonking, we call it.
Yeah, what, bonking, is that what it's called?
Bonking, yeah.
Graham Close is a friend of the professor of human nutrition and stuff at John Moores. We should get him on.
Yeah.
When he was doing rugby, he was the nutritionist for England rugby. He gives the guys their carbs on the days they're training and their matches and stuff, but at the other time he's restricting it. So it is cycling it in for elite performance. But we're not all cyclists, we're not all rugby players. Your average punter out there who's 25 kilos overweight, it's a different...
You don't need, like we said about basal metabolic, you don't need that much carbohydrate if you're not training, really. So to extend that, when I'm maybe having a couple of days off, or I'm sort of having a regenerative week, I'll keep the carbs really low. I don't think I need to go zero. I will be low though, like less than 50 grams a day or something, because I just don't think you need it.
Okay.
So we wanted to go on and talk about actually getting your heart interrogated, checked out, didn't we? But we've only got a couple of minutes left now, so we'll probably have to put that into the next episode.
Yeah, I think it's a whole other episode, but yeah, if you've got a family history, and you know what, I've said it 1,000,000 times, if you've got a family history of heart disease and someone's in a heart attack in their 50s or 60s, you've got to get checked. You can't just leave it to chance. And like, I'll be fine. No, you won't be.
People think that they're panicking, don't they? Or they feel like a bit embarrassed that they don't want to waste the doctor's time or something.
Yeah, and the NHS isn't set up for that. Like, you know symptoms, you're not getting anything. And but please don't leave it to chance.
It can't be worse. You can't make it worse by doing that. You can only discover things or not. So let's talk about that next time. You want to get your heart checked out. What does the doctor do? What can you expect to learn? What might be the ramifications of that?
Yeah, what can you do?
Yeah. Anyway, listen, we better call this to an end because I'm dying for a Snickers.
Marathon.
All right then. Catch you later.